Hi, this is Trinity. Let's talk community centers. Okay, throughout my life, I've been to a lot of resource centers. I've worked at community centers. I've spent a lot of time just hanging out and listening to people's stories. And so I'm going to talk about the different kinds of community centers because I want to see every community have a center where people can come together and get resources and services that they need. You know, I want it to be based on the whole community and not necessarily just targeting, you know, one demographic. And then here's why. Let me tell my story. Okay, so there's a center in Sacramento that I used to go to. And this center was very clean. And it was very well maintained. And they had a lot of different classes. And, like, you know, average people were coming there, you know, doing yoga classes and, like, in-depth sort of, you know, self-help classes. You know, there were people digging deep there and doing great things, and that was wonderful. I love that place. I wish I could remember the name of that place. But there was all kinds of resources there. I loved their yoga classes. They had a center, you know, they had a room with computers and people can get on the internet. There was resources to get people that were struggling to get employment, to, you know, get help in whatever their struggles were, to meet people where they're at. Okay, so there's another community center that's in Santa Cruz, and this place is awesome too, but it's a very different kind of center. There's a lot of homeless people. Since in this community there's so much need. There's so many homeless people that you know, most people would be kind of turned away, you know, from this center and not want to go there. But and it didn't chase me away. But so I got a lot of experience in this center. I went there for, they had free acupuncture. This is before COVID. They probably don't have all this stuff now. It's too bad. But they had, of course, they had the computer room, and they had support groups. They had a kitchen, and they had a big, huge room with, like, a little TV and couches and a bunch of tables, and they would do speaker stories in there once a week, where there were people that would come in and talk about their stories and their struggles with mental illness and, you know, living on the streets. And you know, they would get each speaker, I think they got like $20 for getting up and talking. And that was just a great program. I love that. That was ingenious. That's like a way to help raise people up. Instead of, you know, telling people, I'm going to help you by giving you this or that. It's a way to actually empower people by giving them a voice where they feel like their story matters and they have value. Giving them this, like, $20. Come tell your story. And that's just great. I love that program. I want to see more programs like that. And so the other thing about this center is, you know, it's not maintained. It wasn't as maintained as well as the other centers I've been in, and so that kind of can turn people off. The people there were doing such amazing work. I mean, there's such a sense of family, of like the sense that there's a cohesive. There's people there, even though it's a little chaotic at times. I could definitely feel that people really cared about other people, even in times where it was difficult, because there's, you know, some violent and disturbing, you know, people that come there and you know, cause a scene, and they you know, they have to handle those kind of situations. And that's disruptive, and you know, so it's kind of like there is a family there in a sense, but it is a little bit dysfunctional, and I just wish I could see more of these kind of programs. You know, maybe some communities need both. You know, a community center it's targeted for a specific group that's more needy, and it maybe, I don't like the separation though. I want to see it come together. I want to see, like, I want to see a wholeness to our approach to mental health services, because it seems so disjointed. The systems seem so connected, and even like with the amount of money that I believe is being thrown around for all the different kind of mental health services and all the different agencies that are involved with mental illness in different ways. If there were community organizations doing this kind of preventative care and helping people, that just less money would be wasted on emergency mental health services. Like, if someone's having an acute incident, they need to go to the mental hospital now. I mean, that one incident could cost, in my calculations, with like transportation and going to different hospitals and being moved around. My daughter's, it's about 30 grand each time my daughter's been hospitalized, and it's about 8 or 9 times now. I'd say 30 to 50 grand for each incident. And so over her lifetime, if she's going to be this, mental health frequent flyer, that's a lot of wasted resources for each emergency crisis intervention that psychiatric hospitalization. If those resources were more resources were used in the beginning, providing more prevention with community resources, there wouldn't be it would work differently. It's like the system is backwards. I want to see it change. I really want to see it change. If you have something to contribute to this conversation, please let me know.